AEMT Drugs. Lorazepam or Ativan. Indication: status epilepticus, seizures. Dose route: adult, 1 to 4 milligrams, slow IV, IO, IM, IN. Rectal, may repeat in 15 to 20 minutes, up to 8 milligrams. Contraindication: respiratory depression, CNS depression from head injury, hypotension, hypersensitivity. Fentanyl, or Sublimase. Indication: pain relief, non-cardiac only, mild to severe acute pain. Dose route: adult, 25 to 100 micrograms, slow IV, IO, IM, IN. Titrate to effect. Contraindication: respiratory depression, known opiate, addiction, myasthenia gravis, hypersensitivity to opiates. Levalbuterol, or Xopenex. Indication: acute asthma attack, bronchospasm of any etiology, dyspnea and wheezing. Dose route: adult, 1.25 milligrams nebulized, up to 2 times. May be combined with ipratropium bromide duoneb, and a single dose is usually considered effective. Follow local protocol. Contraindications: patients less than 6 years old, known hypersensitivity. Albuterol, Proventil, or Ventolin. Indication: acute asthma attack, bronchospasm, dyspnea and wheezing. Dose route: adult and peds, 2.5 milligram nebulized or MDI. Repeat as needed. May be combined with ipratropium bromide duoneb, and a single dose is usually considered effective. Follow local protocol. Contraindication: known hypersensitivity. Glucose. Indication: acute hypoglycemia. Dose route: adult, 15 grams oral. Buccal. May repeat as needed. Contraindication: altered level of conscience with inability to maintain their airway. Diazepam, or Valium. Indication: treatment of status epilepticus, seizures. Dose route: adult, 2 to 10 milligrams, slow IV, IO, IM, IN. Rectal, titrate to effect up to 30 milligrams. Contraindication: CNS depression, respiratory depression, hypotension, alcohol intoxication, hypersensitivity. Morphine. Indication: pain relief, non-cardiac only, moderate to severe acute pain. Dose route: adult, 1 to 10 milligrams, slow IV, IO, IM. Titrate to effect. Contraindication: systolic blood pressure less than 100, hypovolemia, increased intracranial pressure due to head injury, hypersensitivity, respiratory depression, known addiction. Ipratropium bromide, or Atrovent. Indication: acute asthma attack, persistent bronchospasm, associated with COPD, dyspnea and wheezing. Dose route: adult, 0.5 milligrams nebulized or MDI. May repeat as needed in 20 minutes. Commonly administered with a beta-2 agonist, duoneb in a single dose is usually effective. Follow local protocol. Duoneb not recommended for peds. Contraindication: hypersensitivity, allergy to atropine, soy protein or peanuts. Glucagon. Indication: acute hypoglycemia when IV access is unattainable. Dose route: adult, 1 milligram, intramuscular or autoinjector. Intranasal requires a minimum dose of 3 milligrams. Contraindication: hyperglycemia, hypersensitivity. Activated charcoal. Indication: non-caustic overdoses, non-burning or corroding. Dose route: adult and peds, 1 gram per kilogram, oral. Normal dose in the 50 to 100 gram range. Mix with water. Contraindication: caustic substances, GI, obstruction, altered LOC, or risk of aspiration. Midazolam, or Versed. Indication: status epilepticus. Dose route: adult, 1 to 4 milligrams, slow IV, IO, IM, IN. Rectal, peds, 0.1 to 0.15 milligrams per kilogram, max of 5 milligrams. Contraindication: respiratory depression, CNS depression from head injury, hypotension, hypersensitivity. Hydromorphone or Dilaudid. Indication, pain relief, non-cardiac only. Moderate chronic to severe pain. Good choice for patients with a low tolerance to pain medication. Dose route, adult 0.5 to 4 milligrams, slow IV, IO, IM, IN, titrate to effect, max dose of 4 milligrams. Contraindication, blood pressure less than 100, respiratory depression, known opiate addiction, hypersensitivity. Dextrose, indication, hypoglycemia, dose route, adult 12.5 to 25 grams, IV, IO. Contraindication, hyperglycemia, TBI, stroke, DTs, CHF. Naloxone or Narcan. Indication, narcotic toxicity, reverse respiratory depression. Dose route, adult 0.4 to 2 milligrams, IV, IO, IM, IN. Autoinjector is 4 milligrams, titrate to effect. Contraindication, hypersensitivity. Epinephrine or adrenaline. Indication, anaphylaxis or cardiac arrest. Dose route, for anaphylaxis, adult 0.3 to 0.5 milligrams, 1 to 1,000 intramuscular or autoinjector, repeat as needed. For cardiac arrest, 1 milligram per 1 to 10,000 IV, IO every 3 to 5 minutes. Anaphylaxis for peds, 0.01 milligram per kilogram, 1 to 1,000 IM, or autoinjector, repeat as needed. Cardiac arrest, 0.01 milligrams per kilogram, 0.1 milliliters per kilogram, 1 to 10,000 IV, IO, every 3 to 5 minutes. Contraindication, none in the emergency setting. Amiodarone, or Cortisone. Indication, life-threatening cardiac arrhythmias, refractory VFib, pulseless VTAC, interfacility transfers, monitor only. Dose route, adult 300 milligrams rapid IVP or IOP. Initial dose may repeat in 3 to 5 minutes at 150 milligrams. Rapid push. Do not mix with sodium bicarbonate. Peds, 5 milligram per kilogram, IVP or IOP. May repeat initial dose up to max dose 300 milligrams. Rapid push. Contraindication, bradycardia, cardiogenic shock, second or third degree heart block, hypotension, pregnancy, neonates, infants. Lidocaine or xylocaine. Indication, life-threatening cardiac arrhythmia, pulseless VTAC, refractory VFib, local anesthetic after IO insertion, before fluid bolus. Interfacility transfers, monitor only. Dose route, adult, cardiac, 1 to 1.5 milligrams per kilogram, IV, IO, repeat in 3 to 5 minutes, at half original dose, max dose 3 milligrams. Anesthetic, conscious patient needing an IO, 40 milligrams, 2% concentrate, then flush with 10 milliliter normal saline prior to additional medication administration. Peds, cardiac, 1 milligram per kilogram, IV, IO. Repeat in 3 to 5 minutes at half dose, max 3 milligrams. Contraindication, hypersensitivity to a local anesthetic. Nitroglycerin, or NTG. Indication, acute angina or chest pain associated with acute coronary syndrome. Dose route, adult 0.5 milligrams sublingual, spray or tablet, transdermal. May repeat every 3 to 5 minutes, max of 3 doses. Contraindication, systolic blood pressure less than 100. Increased ICP, right ventricular MI, anemia, and use of erectile dysfunction medications within 36 hours. Ketorolac, or Toradol. Indication, moderate to severe acute pain, various painful conditions, substantial and flank pain, back or other non-fracture-related musculoskeletal pain, arthritis pain, atraumatic headaches, and migraines. Dose or route, adult, IV, single dose of 30 milligrams, IM, single dose of 60 milligrams. Patients less than 50 kilograms and or greater than 65 years of age. IV, single dose of 15 milligrams. IM, single dose of 30 milligrams. Contraindications: history of peptic ulcer disease, GI bleed, renal insufficiency, hypovolemia, pregnancy in the third trimester, nursing mothers, stroke, head trauma, blood thinners, an allergy to aspirin or other NSAIDs, ibuprofen or naproxen. Ondansetron. Indication: nausea or vomiting, with or without production. Dose route: adult, 4 to 8 milligrams, IV, IO, IM, oral, oral dissolving tablet. Contraindication: hypersensitivity. Diphenhydramine, or Benadryl. Indication: acute allergic reaction, anaphylaxis. Dose route: adult, 25 to 50 milligrams, IM, IV, IO, oral. Contraindication: hypersensitivity, lower respiratory disease, nursing mothers, newborns. Methylprednisolone, or Solumedrol. Indication: severe asthma attack. Dose route: adult, 125 milligrams, IV, IO. Contraindication: Cushing's syndrome, fungal infection, measles, varicella, sensitivity. Aspirin, or ASA. Indication: chest pain or angina that is suggestive of cardiac ischemia or an acute MI. Dose route: adult, 324 milligrams, oral, chewable, or a single 325 milligram tablet. Contraindication: GI bleeding or other bleeding disorders, hypersensitivity to NSAIDs, pregnancy, or children less than 12 years. Tranexamic acid. Indication: hemorrhagic shock less than 3 hours, old with suspected need for massive blood infusion, sustained heart rate of 110 beats per minute or greater, and sustained hypotension, systolic blood pressure less than 90 mercury, or a MAP of less than 60. Dose route: adult, 1 gram in 100 to 250 milliliters, normal saline. Administer over 10 minutes. Contraindication: hypersensitivity, active intravascular clotting, DVT, PE. Nitrous oxide. Indication: severe musculoskeletal pain, angina or chest pain associated with ACS. Dose route: adult, inhaled, 20 to 50% concentration. Contraindication: decreased level of consciousness with inability to follow instructions, increased ICP or TBI, pneumothorax, GI obstruction, COPD patients dependent on hypoxic drive. Normal saline, 0.9% sodium chloride. Indication: volume replacement, medication administration. Dose route: adult, IV, IO, dose as directed by protocol. Contraindication: heart failure. D5W, 5% dextrose in water. Indication: dilution in medication administration. Dose route: adult, IV dose as directed by protocol, usually 30 milliliters per hour. Contraindication: patients needing volume replacement, hyperglycemia, TBI, stroke. Lactated ringers. Indication: volume replacement, significant burns, medication administration. Dose route: adult, IV, IO, dose as directed by protocol. Contraindication: heart failure, renal failure, suspected hyperkalemia. Oxygen. Indication: dyspnea, hypoxia, SpO2 less than 94%. Dose route: adult, inhalation via multiple devices, titrate to effect to maintain an SpO2 greater than 94%. High concentrations for prolonged periods of time can cause oxygen toxicity. Contraindication: none. Antidote kits. Name: atropine. Indication: organophosphate or nerve agent poisoning, evidenced by sludge or dumbles. Dose route: adult, 2 milligrams IM, AI, repeat as needed. Contraindication: none. Pralagdoxamine, 2-PAM, organophosphate or nerve agent poisoning, evidenced by sludge or dumbles. Adult, 600 milligrams, IM, AI, from the Mark 1 kit or Duodope kit, max 3 doses. No contraindication. Acetaminophen, or Tylenol, fever, mild to moderate pain. Dose route, adult and peds, oral as directed by local protocol. Contraindication, hypersensitivity. Ibuprofen, or Motrin, indication, fever, mild to moderate pain. Dose route, adult and peds, oral as directed by local protocol. Contraindication, allergy to NSAIDs. IV additives, electrolytes, antibiotic additives. Indication, maintenance of an IV pump during interfacility transfers only. Concerns, note any fever, burning sensation, as well as any swelling, pain, leakage, or redness in the arm or IV site. Fluids without medications or nutrients. Indication, established by medical protocols to monitor, maintain, and shut off an IV by gravity or pump. Concerns, swelling, pain, leakage, or redness in the arm or IV site. Discontinue the IV if absolutely necessary.